I'm sick and tired of this dialysis. You telling me to go to treatment. Go to treatment. Well, every time I go to treatment, they stick me hard. When I had the catheter, I got an infection. I'm just tired of this. I can't hardly deal with this. Waiting for the transplant is like a lifetime. It takes so long. And then I heard stuff after you get the transplant. Stuff happened to you. I'm depressed. I'm tired. I'm upset. I'm angry, and I need something to be done about it. So I need you to listen to me and hear me, because I just want to pull the covers over my head, close myself off in a room, and just never come out. You understand me? You hear me? Do you get it? My family don't understand me. Nobody understand me. The doctor, y'all all on the other side of the dialysis machine, don't say nothing. You know why? Because this is the Lisa Baxter Show. Yes, giving you the 411 in the kidney world. Good night and good day. Hello, everybody out there. This is your girl, Lisa Baxter. I have a fantabulous show for you today. Man, you don't know the half of it. But honey, listen up, tune up, sit up, push yourself up closer, because I want you to listen and hear. I have a wonderful guest tonight rather, but I have a wonderful guest. She's a super duper 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 hero. She's a technician. She's a woman that gets involved in her work. She volunteers. She makes the money. She helps the patients. She's just everything and everything. And I am going to tell you her story today. You understand me? Do you get me? Yes, you do. Her name is Shelba Jones, certified tech. All right now. We've been having a little bit of technical difficulty, but no, nothing stops the show. The kidney story comes out, the work comes out, everything comes out. We are going to give it to you. You still going to get the 411, no matter how you get it. Get it through a talk, get it through a lesson, but you're going to get it. And I'm here to tell you, and Miss Shelba Jones is my guest, who's also here to tell you. And we're just going to work everything out. I don't know if you saw the depression anxiety show this week. It was excellent. It was very real. And that's why I did the skit about depression and being upset, on dialysis, waiting for a transplant, the whole thing. Everybody gets a little upset and depressed, sometimes the family members as well as the dialysis patient. So we all can go through it at times. And sometimes we need somebody to talk to, somebody to pray with, somebody to listen, or somebody to understand, not pass judgment or just throw a lot of stuff in our face, because that's all we hear anyway when we seeing a lot of people and stuff. All right. So this is you're in for a treat tonight. So I don't want to lose you or anything like that. All the shows are dynamic. All the guests are fantabulous. So I just want you to sit up and share the show as well. Share the show. Well, you already know my story. You know, I've been on dialysis for 12 years and I got a transplant. You know that 6 of my siblings were on dialysis. 2 of my aunts, my uncle and my mother-in-law were also on dialysis. And that's what made me start doing the Lisa Baxter Show before I started doing it on this network. And then I wrote 5 books. I started Blessed Kidney Connections as well. You know, so that's what I'm doing. So we have to put the stuff out there because people are out there alone and scared, or think they're alone and scared. But nowadays, there are foundations out there to help you. There are resources out there to help you. I don't know if you ever tried CKD champions. I don't know if you tried For Kidney's Sake, or the Kidney Foundation, or the Renal Network, or there's so many things out there. Catholic Charities, the rent stabilization programs. There are just so many out there. And you have DRE, and you have SHRE. DRE is for people with disabilities. SHRE is for people that's elderly that need help paying their rent. So, if you're struggling in that kind of way, don't let that be your stress to upset you. An answer has came through these programs. So I want you to Google these programs, or you 311 these programs, and you can get a lot of answers that you didn't get before. I mean, maybe you're dealing with an immigration issue. So if you're dealing with an immigration issue, there's also free programs that tell you about that. Catholic Charities have something called Gaining a Voice, and they help with a lot of stuff. They help you with the test. If you had to, do the immigration test to pass, to get your papers and stuff. So there's a lot of stuff out there. There are also a coalition program that will see you if you don't have insurance card. So you can still get your physical done. I know the Department of Health used to do it all the time. Sometimes they did it for free, and then they started doing it for like $8 to $10. So that's one of the things. All right. So that's what I'm trying to tell you tonight, that we care, we love you, and we just going to always put it out there for you and with you. So my guest is back. And
yes.
All right, Shelba. Okay, I don't know. All I can see is up to the top of your glasses. Oh, there you go. All right, leave it right there. That's it. I ain't mad at you. Come on here. Let's do this show. Let's do this fantabulous show. All right?
Let's do it.
Yeah. When the messing is like that, the blessing is right up in that. All right? So let's get going and let's get this forward. So I am so glad to have you on the show, because I waited for you for years. And so now that I got you, super dynamic tech, I wanted to ask you, how did you choose this line of business? I'm going to start with that.
Okay, so this is a real long, sweet, short story. Mm-hmm. I had went to school, and I had just got out like a medical assistant school. And one of my friends,
Shelby, I'm sorry. Steve is telling me to introduce you, so apparently you're not. And I'm sorry I said that. I don't know if they can hear me or who can hear me. It doesn't matter. This is trial and error. Okay. At this time, I am introducing my guest. My guest is Shelba Jones. She's a certified technician. She worked with a couple of dialysis centers. She'll tell you herself her own story. I wanted to come out of her mouth, but I'm introducing her, a wonderful, fantastic person, hardworking person, Shelba Jones. Welcome to the Lisa Baxter Show.
Thank you, Lisa. Shelba.
Thank you, Lisa. Alive and kicking. Alive and kicking. Alive and kicking.
I love that. That's your spirit is always awesome.
Oh, thank you. Thank you. There's some pain, but I ain't going to let nothing stop me. We going to do this show. What I tell you. Now, how did you get and choose this type of business or type of position for yourself?
Actually, Lisa, it kind of chose me. I didn't know anything about dialysis. I started in dialysis in 1984. A friend told me about the job. That's when they hired technicians right off the street. You didn't have to have any training. They train you in the center, and it went from there. So I went into a job, didn't know nothing about dialysis until I started 35 years ago.
And 35, woo!
35 June 11th.
Congratulations.
Yeah, thanks. It's been rewarding, and it's been a learning experience also. Um, so the job in itself, it's a lot. You learn a lot. And you know what? Your patients teach you the most. And
Mm,
that's the great thing about it. Sometimes just being sitting there while you waiting to do their blood pressure, or just having a conversation when they come through the door, you learn so much from your patients. They teach you, actually. They can tell you about the access. They can tell you about what's wrong and what's not right. So it's a good experience and a good vibe, especially with the patients. And my,
wow.
my passion is always educating and
Mm,
helping the patients to grow. Because a lot of times patients come through that door, they got a catheter in the neck, they don't know what's going on, and they're like, why am I here? I'm only here for one day, right? No, you're gonna be here for a minute. So
wow.
it's different, but it's good. And what I like now, opposed to then, a lot of patients just didn't know what was going on. Now the patients are coming in more educated. They're on the transplant list. They got themselves ready. They got an access in their arm. They have a catheter, getting it removed. That's a good thing. Before, they didn't
Yeah.
know anything about that. They, meaning the patients, or sometimes the staff, we didn't know. Listen, there wasn't a dialysis on every corner when I started. Now you got one in a 12-mile radius. Let's be real about that.
Yeah. This way, that way, and that way. Yeah.
Exactly. So
Hmm.
it's that's how I got into this field. And then I started to volunteer with National Kidney Foundation, learn about the kidney walks, just going to their kidney screenings, which was really good in the community. They would do them monthly, and I would always volunteer and learn from other people. If you didn't have any insurance, you could get that free kidney screening, go and see what's going on, get some
Well,
appointments
say
going.
that. Say that.
You
Well,
know,
we did the kidney walks together. We've
yes,
done
we
a lot
did.
of things with the Kidney Foundation together.
Exactly, exactly.
Yeah,
And
documentaries as well. But say that they could get that screening. Say that again, please.
get that screening. Get that screening for free. You never know. Getting that blood pressure check. You never know what's going on. We all know if you got hypertension or diabetes, you already at
Come
risk.
on
And
now.
we already in stage 3 if you got one of the two. People don't like to hear,
Wow.
but it's true.
Mm.
You
Kidney
know,
disease too. I came in on the kidney disease, that polycystic.
you know,
So I came on that riding horse, the horse I didn't want to ride on, rather. Now,
exactly.
take me back 35 years ago when you got your training. Give me a little taste of what that training was like or about.
That training 35 years ago was, you got trained for 2 weeks. It was in-house training on the floor. You had classroom work, and remember, what we do now is infection control PPE. I didn't wear scrubs then. I wore a pair of jeans and a lab coat. That was the requirement. You didn't have that PPE, you didn't have all that gear. You did have a mask, but none of that. So back then the training was, hands on. You learned, you got the dynamics, the anatomy, the physiology, and all that, but you learned the patients. You had to get their confidence, let them stick you. You practice on one of the arms, and you also went out on the floor, but you really had to gain that person's trust to let you put that first needle in.
You
Sometimes it
better
took
gain the trust.
3 weeks. Now I look at some of the staff when I go into in-center, they're sticking in 2-3 weeks after they're there, trying to get that needle in. I'm like, oh, okay, this is a lot different than what I did. And a lot of procedures I did then, they don't do now. So it's totally different.
So you see the comparison of it.
The compare and contrast. I mean, like if you come along some of the new technicians now, and they'll say, "Oh, Shelba, you're an old school tech," so I can think about some things that I know how to troubleshoot and do. Where some of the new staff like, "Oh, I don't know that." They'll try to like get out of it. I said, "No, it's a way to do that. You can just be a little patient
Yeah.
and it can work." And a lot of times you
Preacher.
get that now. You don't get that. So you
Hmm.
got to know how to troubleshoot. And you got to know how to make it work. We made it work. And we made it work to the patient's safety. You know what I mean? So that's the
Oh
good.
yeah. Now that's good. That's good because a lot of times, people don't always want to learn from you. You get a little older and they want to just throw you away, but
Yeah,
that wisdom is a good thing.
it
I
is.
mean, knowing new stuff is nothing wrong with that. I want to learn new stuff too. But,
Right.
knowing the old stuff or some of that other stuff that you can't get with the new stuff, ain't nothing wrong with mixing a little bit of that together. You
I-
know, yeah.
Exactly. I'm with that. So that wisdom is good, but so now the younger generation's a little different, and they, sometimes they hesitant, resistant. So sometimes,
Yeah.
what, let me show you what I'm doing. And then
Mhm.
sometimes they say, let me You get few that don't want to, and then you get
Uh,
some that really want to.
well,
So
you
that's
always
the
get
difference.
those jelly beans. The jelly beans, a whole bunch of different ones in there. So I ain't mad at you. I know that's right. You ain't
Yeah,
never lied.
I got to
You
keep
ain't
it
never
moving.
lied. You
You
know.
gotta keep it moving and keep it right for the patients. You got to keep that safety going.
Oh yeah. Well,
You
how was
really
your
do.
first stick? How would you say your first stick was?
My first stick was not a good stick. Patient was howling, screaming, infiltration city. So to make
Wow.
it short, and I said, "Oh my God, this patient is not going to let me come near him no more." Actually, he did. You know what I mean? You got to get the grafts, you got to get the technique, you got to feel, where the flow, and I was like, I got this. I didn't
Yeah.
have it. I went right on through that vein. He was howling and screaming, I was crying.
Everybody cried, huh?
Everybody
Yeah, I
was
remember they
crying.
used to feel your arm, feel the bead and the bumps and
Yeah, the
even
bruise.
before it was a bump, yeah.
And my other preceptor said, "Oh, it's a big old brewery. You ain't gonna go that." I went right through it and missed it. So I was not happy, sad as can
Wow.
be. But time and patience and experience. So that's what you need.
Wow. Wow. Well, I'm glad you stayed with it because I know that you're a good tech and everything. I'm glad you're still in it and you stayed with it and everything. What was one of your glorified experiences being a tech, you would say?
When I forget some of the patients and they come back and they remember me, and I'm like,
Ah,
that was so long ago. Or they'll say, I remember you. That's really rewarding. Or if they get a kidney transplant or they're doing another modality, they'll come back and say, I thank you. Just 2 weeks ago, one of my patients on the evening shift got a transplant, and he said to me, you know what? Thank you so much. And then another young lady, she transferred from our center. She got a kidney at PA Einstein. She said, Shelba, I really remember the evening talk. She would come by and say, are you going to another center? Are you doing it in another state? She said, thank you so much for that. That was encouraging, and it kept me lifted, and I pursued it, and I got a kidney transplant. So
wow.
those things make me feel good. And just getting the patients listed and getting them ready to have that hope, that it's going to happen, that it's not just doing dialysis, they doing some other things, or they being out there giving some other patient who had that low self-esteem, don't want to be there, cutting treatments, missing, skipping, talking to them, come on, it's a better way. Let's try this way. Let's try another way. Let's like a buddy system going on. So I like that.
Oh
Or
yeah. Oh yeah.
so that
So
that
the,
that works. You
well,
start
yeah. Go ahead. I'm sorry.
you start to see patients that didn't want to come in out in the waiting room, holding court, talking. Hey, they got their own little thing going on out there, and they got some other patients listening. So you like that. You also got some negatives doing that vibe, but you know what? You let
Always.
that roll off. So
Hmm.
you got them two positive that's making a difference of the other eight. You got it.
Well,
So that's good.
you encourage them to like you said, the buddy system. You
Mm-hmm.
encourage them to hold court out there while you're waiting. That's your
Right.
biggest chance, because while you're waiting, you got some attention going on. You get some of it on the machine, but you don't get that much attention on the machine.
No.
But while we're waiting, you
Yep.
get a little more attention. So I'm
Do.
glad that you encourage that. You have any advocates or anything in your center?
Yes, we do. It kind of died down a little bit, and now we got that back on again. We got two, and we getting two more from the shifts, so it's really good. And you know what's so positive too? I had joined CKD Champions with Dawn Edwards, Stephanie Dixon, and Aaron Battle, and that
My
is
next question. Uh-huh.
that has been a most good experience, because a lot of times the patients need to know what other patients are doing, and doing them, they just take it to a new level. They
Sure.
got some information, they got some wisdom, some knowledge, and the patients want to hear that. Dawn with the next stage, and Stephanie with the infection control, and Aaron
Oh, that's tough. That's right. You
talking
preaching
about
now.
talking about the transplant. So you got all of they doing those lobby days. They rocking. CKD champions really, really moving on and above with that, getting those patients. And you know what's great? They getting the ear from the clinics and the clinic managers and the FAs, the facility administrators. Excuse me, I'm talking so fast. Facility administrators, and they letting them come in and doing that. And that wasn't happening before. If I'm for cities, I only want this particular person, or I'm the I want this particular. No, it's not that anymore. They letting them
Good.
in. They want that patient engagement, and that's the part. That's the important part.
That was the key that was missing from the beginning, because just like you
Exactly.
know in Alcoholic Anonymous, Anonymous, alcoholics reach alcoholics. Same thing with kidney patients. You know what I mean?
Hmm.
Or mamas reaching
Hmm.
another mama. You know what I
Hmm.
mean? You have to have
Exactly.
something that you have in common so you can
Right.
get that hook. You know what I'm
Right.
saying? We all
Exactly.
need that hook. You know what I mean? So I'm just glad that you have that. Now you also on the ESRD network, right?
Yes, I'm
I'm
on the.
in that with you too. Yeah.
Yeah, and I was really happy when Miss Pilgrim said they said I nominate you to be on that. I was really really happy because I said, you know what, this is a good outlet, good avenue. I get to get to connect with a lot more other of my peers, and I like that,
Yes.
patients and staff and
Yeah.
all around. So different people are from all different beings, and I like that. So that's good. And you know what, I bring that back to the patients. And at least I got to give you a compliment. Also, again, you came to our clinic with your book and all. You had a job outlook. Patients was very encouraged by that. I
Oh,
had Stanley Jones. I'm a name drop. I can do that, and he was very impressed. He said he had met you, and you told him about jobs and housing. He was really, really, and he moved that to other patients. So that's a good
wow.
thing.
Oh, you better go ahead. Don't you start nothing in that corner.
I'm
Thank you
sorry
so
I'm in
much.
that corner,
Thank
and
you.
I,
Thank you
I
so much. Thank you so much. I mean, I'm just proud of you too, because you deal with all of these things. Now, when you did the documentary with the Kidney Foundation, remember we did one. What
mhm.
made you do that, and what was your role in it?
When I did the documentary at the Kidney Foundation, they was looking for to tell more about it. They was trying to get that um, positivity out there and let people know about kidney disease. So I said, I don't mind doing it. That's something I want to be awareness. I just want to take the scope of chronic kidney disease and just run with it because it
I
was
know
something
that's
I
right.
had a passion for. Actually, that's all I know, Lisa. 35 years, that's all I know.
Hey,
So
hey,
I'm going to claim it as I see it. So
yeah.
with that documentary, it just brought out different avenues. And I have to go back to Ellen Yoshioshi from National Kidney Foundation. She was my mecca. Anything that was
Uh,
going on that she would needed me to volunteer for or do, I was there, a part of it, trying to help, making a
yes,
difference.
yes,
So that took me to another level.
yes,
So I ever so grateful for that.
yeah.
And it's just that documentary just brought out more. But sometimes we foresee a lot earlier than others did. So
All
we
right.
forefront knowing all this is going on and it's happening now. It's just happening as we've been stating and preaching it. So
All
that's
the time. That's
all
right.
the
That's
time.
right.
All the
When they
time.
was doing that documentary, they had followed me around. They wanted to see how it was in the life of my life, following me around, a date with my husband, see
Mhm.
how I act in my home, how I would take my blood pressure, stuff I did for fun. So they followed me while I ran and I jogged and cooked and cleaned. They just
Mhm.
followed me all day long,
Right,
and they just saw the highs and the lows, because you got to show all the truth.
right,
And that's
right,
what our
right.
show is about, not just looking up here looking cute. That's why I admit that I was in pain. I admit that, whatever was going on, because
Exactly.
it's the truth. And this is live, so tell it like it is.
Is. That's true.
You know?
But you're right. I did do a documentary of a day in the life of a technician. That's probably the one you saw with Fresenius. That one was really good too because they came early in the morning when I came in, and I just took them in a day in the life of what we do, talking to the patients, putting them on, monitoring, and just having a good time with the rest of the staff. So that was really rewarding. And they always play that video every October when it's Technician Week. And I really
Wow.
appreciate that because you get to see people or say, "Oh, I know you. You was in that documentary." And funny story was last year, one of the young ladies came for an interview, and she said to the clinical manager, "Oh, I want to know. There was a person here that did a documentary about a day in the life of PCT." She said, "There she go. That's her right there." I said, "Oh my God." I said, "So people remember. So that's rewarding also.
Oh,
That
yeah.
you
That
make that
touched
good.
your heart.
It
It
did.
really touches your heart. I
It
walked in Robeson one time and they were playing the documentary too from the
did.
Kidney Foundation. I knew Kelly Collins. She got married. She had a baby now, but
Right.
she was a good instrument. There was so many of them in there that was a good instrument that had so
Right.
much stuff. They remember the hotline that they had where you could reach other patients and help them to talk about dialysis through the phone. It was
Well,
a
you
number, a
could go.
neutral number And so I
Yeah,
had to do that and take training with that. So it's good. There are good things out here if the patients only know about it or tap into
it,
it.
it happened. Well, Lisa, you like the mecca for that because you in on everything, and you even exposed me to your kidney club. I knew nothing about that, and I told a few patients about that. So when I'm going to pass that information along too, because a lot of times I think patients aren't listening; they're listening, and some of them follow up on that. So that's really good.
Thank God.
So now I'm working home therapies for
Next
Fresenius
question.
Medical
Boy,
Care.
I love this. We flowing good because that was my next question. I ain't mad at you. Come on here. Yes.
Well, listen, they took it. I took a jab at this. I started November in home therapies, Queens Home Therapies. They have two technicians, myself and another young lady, and that was a different vibe. I wanted to learn the modality, but what I'm learning with that is, now the government wants patients doing it at home. Trump just signed that with more organ supply freeing it up. So home is the
I saw
place
that.
to do it now, to be there and be on that forefront. So I didn't see it then because I was very hesitant about that. I've been an in-center baby forever. And to come
Yeah.
to home, it's been a big difference for me. But now I'm trying to adjust a lot more and I'm learning more. And I'm really happy about the HHD, the home hemo. They got the first home hemo patient in Manhattan. Two of the nurses and the tech is doing it. The next patient I'll get. So that'll be very, very rewarding to see. And now we're trying to push and see if we can get more staff on board to do this
Yeah.
home therapies. And it's the new.
It's
So
the new new, huh?
it's the
Well,
new new.
what did you train in there? I mean, what was the training consist of?
Okay, so for the PCT, they really hadn't defined the role for the PCT. So what I
Okay.
did was I did virtual learning for the PD. I'm not okay. First of all, we can't connect and drain the patient. We can reinforce the education what the nurse gives. We can get the
Okay.
eyes going, get everything ready for their home visit, get them set up for their home. They have all their supplies, what they need, get them on their monthly appointments, whatever else they need. And what I do, I take my passion a little bit further. If they're not on the transplant list, I try to get them acclimated to get the transplant because that's CMS want that. That's a big part now too. So all of
Mm.
that's the part. Now the HHD is going to be a little bit better for me because I already been in center and we can create the buttonhole technique for the patient, help set
Oh,
up
I
the
remember the
machine.
buttonhole. Yeah.
So
Mm.
that's been my passion. I've been waiting for this HHD. So once again, doing that was told me we gonna do some stuff, come to her house and help us set up and do what we need to do, name dropping again. But that's just all the people out there want that connection to roll. I like that.
Well,
So
that's good.
it's really good. So home therapies for New York, New York have strict regulations and not like other states. So the
Right.
technicians very, very closed in on what they can do right now. But I'm sure it's going to open up a little bit later. So right now we just being that extra helping hand, freeing up that nurse so they can do more with the patient, so we can get that ordering done, get the supplies, and the HHD we can get that cannulation going and help that patient do those blood pressure monitors with the PD, just actually getting that patient ready and educating them about how their diet, also making sure the fluid restrictions, getting that lab work so those KT over V's can meet clearances and stuff. So that's a very important thing. So it's good. I learned something different. It's very different for me.
Wow, you take a lot of education in, and not too many people do that. And you've been on both sides, like you said. You a technician, in-house baby, so now you're doing the home thing. So I
Yep,
like your diversity of doing this. You know what I'm saying?
absolutely. You know what? I would never let Incenter go. I'm there still every Saturday, and I
All right.
still come in and do my transplant data for my clinical manager, Miss Loretta Anderson, who's an awesome clinical manager. So it's good. And I'm now in home therapy. I have Samantha Morgan. Was I was her preceptor before she became a nurse. Now she's my
Wow.
clinical manager. So that's good stuff. Good
Wow.
awesome people. So you got to work with people who's going to give you that drive to move, and they've given me that drive to move. So I'm happy with that, Lisa. That's a
That's
good thing.
good. That's good. Well, what would you say to a person to get them to do your home dialysis? I want the pitch for that, and then something you would say to another technician, a new one or an old one, any type of technician.
For a
Go.
patient, okay, for a patient that wants to do home therapies, first of all, I want to have that education conversation with them,
Okay.
make sure they want to do it. Or if they don't want to do it, just give them the information, it's the flexibility. You do it at home. You can, we'll also train your caregiver to help along with you. Also, what's main important about that, we're going to tell them the do's about the peritonitis, make sure they keep themselves clean and
Oh yeah,
stuff.
please tell that one. My
That's
sister
the
dealt
main
with that. Yeah.
that's the main thing. But also they want looking for that flexibility. They want their life to move and grow. Home is the way to go. And actually, if they don't want to learn it then, maybe come back and revisit us in 6 months. You don't want to push people because sometimes they think
Right.
of the
Right.
negative
Let it be
part.
their choice. You don't want to
Yeah.
force them.
Right. So that's the first thing I'll tell them about home. And you know what? Give it a try. Take the information, learn the information. And a new technician coming in, I said, give it a shot. I always want to see people grow. If it's not for you, that's maybe so also, but give it a try because you never know which way you can take it. I took what I knew how to do and made it grow for myself because I'm a person who's always going to do something. I got to be moving. So for
Mm.
me, I said, I'm going to do this, I'm going to do that, I'm going to tweak it, I'm going to turn it, I'm going to volunteer. If that's what it takes, I'll do that.
Hey, I ain't mad at you. Me too.
Yeah. Yes, yes,
Yeah.
Miss
I jump into everything. I
I'm,
jump into everything.
yeah,
Where you at? Come
yep.
on.
That's the main thing. You gotta give it a try. You just can't be, I'm tired of doing this. I used to say that a lot about Incenta. I said I'm gonna give something a try when it comes moving. And some of the nurses came looking back for me for the home therapist. I was like, should I make this choice or should I not make this choice? But I said I'm gonna give it a try. You don't know until you try. And they said you always can come back to Incenta, Shelba. I said, yeah, you're right. So let me try, and I'm gonna keep coming on Saturdays and learning my skills in Incenta. So it's a good reward. And any technician now, try it. Just try it.
So you think they should try it? I ain't mad at you. So you keep your skills sharp.
I try to keep them sharp. I mean, I'm getting a little rusty, but I try to move it and keep it going.
Hey,
And what I do like is on Saturdays when I come in, if there's in service going on, if there's paperwork on the table, they say, Shelby, pick up, there's something going on. And they got the preceptors now. You have preceptor threes who let me know what's going on. So that's a good thing. So you got to keep that. One thing I can say about Fresenius, they'll train you, baby. You'll get that training from me. You got that
yeah,
virtual
I was
learning
in there
going.
in two of their centers too, and as a
Exactly.
patient, and they were very helpful in a lot of
Yeah.
ways, and they were,
Yeah.
and I was
Yeah.
able to say something because I was the advocate
You
first of
were.
all,
And
yeah.
everybody knew you. Everybody knew you. And I just got selected for their Fresenius PCT uh what is it council. I'm on the PCT council across the nation. So I was like very excited about that. I did 2 calls with that. So that's really, really good. So now they want to see how
Congratulations. Tell them
yeah.
what PCT mean. You said a lot of acronyms there. You better tell my audience what you saying, girl. Some of them don't know.
Okay, so it says PCT is a patient care technician.
Mm.
However, I would like to get that while I'm on this was to change that to dialysis patient care technician. PCT can be anyone's a PCT, and I think that need to be defined more. So you're a
Mm.
dialysis person. Everybody that's a PCT don't do dialysis; they do something else. So that
Yeah.
that needs to be a name in the word with that because
Narrow it down. Too
yeah.
wide a range.
Exactly. So,
Yeah.
and with this council, we're trying to come together and just collaborate and help other PCTs get the retention down of PCTs leaving. And also, they were all about that home therapies. That's the second thing
Wow.
to do. Grow that home. How can we get the patients more engaged in home? How can we get the patients more engaged in just educating them about it? And some of the staff, most of the staff, they really want to try to get them to diversify the nurse to make them try to know, learn both, which is a good thing. It's a good thing. So that's
Okay.
so this council, I'm kind of looking forward to this. So this will be very interesting. I'm gonna keep you informed on that.
Okay. I would like to be informed on that. Everything that you do, at least you know what you're doing while you're on it. So
Right.
because I see you got different, levels of your of education that you ball together, and you on different levels and planes, but you all keep it together. They all meet in the middle where it's still a good service for everything that you do. I like that.
I'm glad you do, because let me tell you, and I got to lay it all out there and keep it real. At first, I just thought none of this was making sense. I said, oh my God, I've been this PCT forever. Nothing's making sense here. I need to get a little more focused and grounded. I got to put all this in a nutshell. And now for me, it's actually coming together. Once that I'm seeing that, you know what, home therapies is what they're advocating, they're pushing. So I really got to do. I'm kind of feeling a little bit better now, a lot more comfortable than what I was. November, December, January, February, March, I was not comfortable. I was like, oh my God, this is horrible, But
Yes.
now it's better for me. If you
Yes.
feel good, then you make other people feel good, you
That's
know.
right.
And if
That's
you
right.
feel
Say that,
alive,
girl.
if
When
you
you
feel
feel
alive,
good, I'm loving that. Say it again.
when you feel good, other people are gonna feel good. You
Mm,
know, and if you ain't
I like
feeling
it.
good, you can't make that flow, make that vibe. It won't
Come
happen.
on now.
So I
That's
gotta
right.
keep it 100, Miss Lisa.
Hey, 100. Hey, keep it 1,000. I ain't mad at you. I ain't mad at you. Anything would you like to add? Anything you would like to say? Anybody you like to give a shout out to?
I want to shout out to everyone. I just want to just give all the blessings, first of all, to the Almighty, and thank you, Lisa,
Hallelujah.
for having me on the show. Again, the CKD Warriors champions. I want to thank them. They gave me the opportunity to get on their board, and I'm learning a lot. Um, all the councils, NKF, Fresenius Medical Care, the clinical managers, Miss Loretta Anderson, Miss Samantha Morgan, just all of those people. And I even have to reach back to one of the oh my God, one of the VPs a couple of years ago, Miss Judy Moran. They gave me this forefront, Mike Slomer. They gave me all these forefronts to just get out there and just drive for it. Don't stop. It's gonna be what you need to be at when you need to be there. And that's what I need to be at where I'm at now. And I just want to thank everybody for giving me the opportunity. I want to thank you and Steve for giving me the opportunity. I haven't been on me a phone call like this and doing me an interview, so I'm
Oh
very
goodness.
elated.
Listen at you.
And
Yeah, him and
Lisa,
Tamika do great work. They're a team. This is their thing, and they do a team, and we just one big family on this thing. And everybody that comes on the show is a part of our family. All the audience is also a part of our family, and anybody out there that want to be on the show is a part of the family. Come on
well,
in.
I'm so glad, and
Welcome.
I'm so glad when we had the cultural event, I didn't get a chance to speak to you and Steve then and Tamika, but I'm glad I got my opportunity tonight. I feel very special.
I wanted to give you your whole time, not
I got
just a little piece.
I got my time and then some.
That's right. That's right. And
I
that's the
did,
way we do things.
yeah, but y'all guys do. I like the forefront here. This is really really nice. Once we got it clicking tonight, it clicked on.
Oh yeah. Oh yeah. I'm glad it came out good. I appreciate you for coming on, being on, giving your knowledge, telling the truth about stuff, putting it out there, encouraging the patients, the family members, and
Hmm.
and even the staff, because we all need that pat sometime. You
We do,
know,
we do,
we
and
get enough stuff in our face and thrown negative, so it's nice to hear something good
yeah,
that's going on in or at a center or through a person's life.
right, yeah. We do have every place center unit has problems, but you know what? We're
Yes,
gonna put that aside for a while and just do what we do. You know what I mean? Because at the end
yes,
of the day, we
make
still
it happen.
gotta take care of that patient and make them safe, happy, and make their family members, understand that we're doing a good job. If you're
Right.
not doing a good job, then that's gonna be some backlash.
Oh
But
yeah, bam,
but
bam, bam. That's right. That's true. Yeah.
so we really have to do that. And with that being said, I'm just glad now that I did continue to stay in dialysis. So some good things are happening, and I'm happy for that.
Well, I'm glad you didn't jump ship, and I'm glad you keeping it up, even though that 35 years is a nice chunk. Keep on chunking,
Yeah,
and
I'm trying.
as long as you can, as long as you can. And I'm glad that you enjoy it. And I'm about to end the show. There's any last minute tidbits, gold nuggets, anything to say, to spew, to sing, to preach? Let me know right now.
keep on keeping on, guys. Just keep on keeping on. We're going to fight this disease until the end. And it has to be talked about more than what is not being talked about enough. But with the forefront of the people like Steve, you, Dawn, everybody's out there giving that, we're going to be all right. We're going to make it. We're going to make it. We're going to stamp this disease.
That's right. It's going to grow. As Stephen would say, smashing kidneys. I believe he has a show on here called Smashing Kidneys. We smashing those kidneys.
Yep.
For the better. For the better.
Yes. Lisa,
well, that said, I'm going to say thank you again, and I'm going to say good night. The best to your family, the best to you, and thanks again. I appreciate you.
I love you. Thank you for having me.
I love you too.
Really?
I love you too.
Made my heart glad. I enjoyed this.
I did too.
We had conversation.
I enjoyed it.
That's all right. That sweating was good, baby. That's a good sweating. You was the hostess with the mostest.
You better go ahead and preach. I ain't mad at you, but I love you, and I'm going to say good night, farewell, and peace. Keep doing what you're doing.
Thank you, baby. Love. Bye-bye.
Bye-bye. Well, guys, you have heard it. You have heard it all tonight from a super duper technician, a real diva in the technician kidney world. So look at it, and I'm just glad that you're looking at it, that you heard it on tonight on this show. I love you to the moon and back. Thank you. See you next week with a different and another guest. I appreciate you, and blessings, peace, and happiness. Good night.
Good night.